Well, welcome everybody. Welcome to the Arafmi Q&A. Before we start, I'd like to acknowledge the traditional custodians of the land in which we gather here today. So in Tenerife, it's the Turrbal and Yuggera people. So we include Brisbane north and south of the river. And I'd like to pay respects to elders past, present and emerging. I'd also like to extend a thanks to all of the employees who've been able to join us today and acknowledge that because of the timing of the meeting, we're not going to get everybody attending, but we are recording this meeting as we do with all of our staff Q&As, just so that people who can't attend can still at least hear what we've got to say. So hopefully it'll be a relatively brief one unless you're super chatty. What we're going to cover today is I'm just going to go over our COVID response, talk about some of our staffing updates, a little bit about the board strategic planning. That's not been finalised yet, but I wanted to just give you a little bit of an overview of the key themes that have come out of it, and then open up to any questions that you have. For those of you who haven't been in the group chat before, there's a group chat text area. If you're not sure how to use it, let me know just now and we'll get Jen to talk you through it. So I'll give you a second to, if anybody doesn't know how to use chat, can you let me know? Oh, you're all good? Cool. So if there's things that come up, we would prefer if you type it in chat and then we'll get to it through the course of the conversation. Cool. So first of all, COVID update. I'll start off with a thanks. As per usual, you've been incredibly fantastic at managing our COVID response. I think since the start of the pandemic, we've had about 3 scares where people have not been well and had gone and get tested, where we've had to ask people to take a few days off. But I think by and large, and we're very supportive of doing that if you need to. So if you are feeling unwell or you feel like you need to self-isolate, please let your line manager know and we'll work through that in a supportive way. But in the circumstances where we had the 3 scares, we immediately implemented not a lockdown on the services, but a way of making sure everybody could isolate until we got results. And I think we've been very lucky that anybody who's had a scare, the results have come back negative. So thank you for your diligence, not only in maintaining appropriate hygiene levels and safe distancing and all of the things that we've asked you to do, but also for your really proactive and honest communication when you're not feeling well. And I do want to acknowledge that we do have the majority of our employees, especially in the support worker space, are casual, and that there is a fear about if you take time off sick that you're going to lose income. And I really appreciate your honesty and your proactiveness and coming forward with your worries around that. And as I've mentioned in a few other meetings, we will support you as best we can with how that looks. So if you are feeling unwell and you think it's COVID related, to talk to your line manager and we'll work through it with you. So Jen, are you okay to put up the infographic that we discussed? So I just want to re-go over what we've talked about through COVID. At the moment, Queensland's probably a really good example of how to manage COVID response, and I think we've been very lucky with our geography, and the response from Queensland Health's been very good. We don't have many cases of COVID in Queensland, and they're all being significantly managed. So we do consider the risk of infection within Arafmi to be relatively low risk based on the population. But my worry around that is that we might, because it's low risk, we might slide into complacent behaviour. And I think that we've been so diligent previously that it's like we've had such a good response. I don't want us to slip back to old ways. I was chatting with somebody yesterday who was telling me about the stats for flu in Queensland. They said the statistics for flu in Queensland have significantly dropped this winter, partly because people are practicing good hygiene and social distancing. And it's always a worry that I think, well, maybe we were a bit grotty before and we just weren't good at washing our hands. But I'm hoping that the cleanliness side of this can be something that we take forward regardless of COVID, that it's just good practice. So Jen, are you able to put the infographic up on? Yep. So can everybody, well, I'm assuming everybody can see the COVID roadmap infographic that we've got. So it's just to remind you all around the 4 key criteria that we've asked, and to just reaffirm some of the activities and the do's and don'ts. So obviously, if you're not well, please stay at home. We will absolutely support in terms of any worries you have around finance. We'll talk you through that, and we'll look at supportive measures for you. And even if it's last minute, we'll cover your shift. We just want you to do the right thing about staying healthy and well, and making sure your colleagues are healthy and well. Obviously, there's the washing your sanitising hands. We provided hand sanitizer last time, and we've got some still left in the office that we can distribute more of. But again, we're very happy if you want to purchase your own, if you've got a preference for the type that you use, and claim it back, and we'll cover the cost of that. With regards to service delivery, we're still comfortable with you avoiding crowds, and happy to support a participant support plan if that's something that we need to do. So we're still not supportive of you going into big public spaces if you're not comfortable. We know that Queensland is relatively safe, but we're still comfortable with providing a social distancing environment. And if you can't guarantee social distancing within things like big shopping centres, we're absolutely supportive of you not doing that. Laura and Katrina are here. I think Katrina's maybe still struggling with her audio, but Laura, could I ask you to pop in now and just give a bit of context around the service delivery side for the crowds, and how best we support staff to do that?
So as you guys would be aware, we had developed COVID support plans with people. So those still stand. There might be some modifications now that some sort of services are recommencing, then people are able to go out into the community more. But those things that are still recommended by the government, such as avoiding crowds and still practicing social distancing practices, definitely still keep that in mind when working with those clients, and remind them that it's not just about keeping them safe, but yourself. And if they are putting you in a position that they are making you feel unsafe with what's required of you, just to keep yourself safe from COVID, then get in touch with your line manager, and they can support you through that, and they can also support talking with that client so they best understand why those sort of measures are still being in place, even though it might appear that things are returning to normal, because those can be difficult conversations with people at times.
Yeah. Thanks, Laura. And I think it's fundamental. Your safety is the priority. And although things are relatively low risk, social distancing is still recommended, and in some areas required. And that includes areas like our respite accommodation head office, etc. So we're absolutely not asking anybody to provide services that, hi Anne, that don't allow for social distancing. So we absolutely are still reaffirming that that's something we should be managing. And it's not about saying to clients, no, we can't do something, or that clients are intentionally putting us at risk, but I think we owe it to the people that we're providing services to have proactive and honest conversations about what's okay and what's not okay while we're still managing the pandemic. Where did Katrina, I think Katrina popped off again. Is Katrina still here? She's maybe popped off. I'll maybe ask Katrina to see if she's got anything to add to that. One of the questions that we had around COVID was, I think because everything's a bit more relaxed, we've maybe slipped into some practices that we were a little bit sharper on before. And one of the examples I can give is, we'd recommended or we'd directed for clients that you're taking in your cars to go on the back seat on the passenger side, and that was about creating the maximum amount of distance from you to the client where possible. That still stands for us, that should be the practice. I completely appreciate that might come across as almost feeling like a taxi service, or that it's not the most engaging way of working with somebody through their transport needs. And I think there'll be occasional times where I think there's going to be times where it's the right thing to do. But I'd like to just remind people that the expectation from you as employees is that the clients still sit in the back on the passenger side where possible. If there are exceptions to that, I think talk to your line manager around it. It might be that there's physical practicalities around transferring to cars that we can't do it any other way. So if there are exceptions to that, I'm happy to talk through those individually. And I'll be completely honest, I was in the car with somebody last week and I'd completely forgotten about the guidance to do that, and it was halfway through the journey I was like, here's what we should be doing. So I recognise that because it's been a bit more relaxed and we feel a bit safer, that it's easy to forget all the good practices that we've put in place. But I'd like to just remind you and reaffirm that that's a really important part of our practice. Hi, Katrina, welcome back. Katrina, was there anything you wanted to add to the service delivery aspect, especially around COVID and do's and don'ts and how employees are doing?
Well, I think the big message is that I think we're very, very lucky to be living and working in Queensland at the moment, and poor old people in Victoria are doing it pretty tough. But if we don't stay vigilant, we could be in exactly the same position. So I think that's the ultimate goal, is that things could turn around very quickly as far as COVID goes if people aren't continuing to practice all the safe COVID hygiene measures, social distancing, and just being vigilant. So that would probably be my biggest message. But apart from that, I think everyone needs to be rewarded for how well they've coped through the situation. We've been so lucky as an organisation. We've basically come out unscathed. I don't think we've had one reported COVID case. So that's to be completely commended. So well done, everybody.
Yeah, thanks, Katrina. Yeah, you've done phenomenally well, and I do recognise the level of stress that it's brought to everybody. And I think I said in one of my first Q&As, I think support workers and people who are working out in the field have a different level of stress than people in the office. But I think the stress has been felt across the board, and certainly I know Laura, Katrina and Kerry, we've had a late night worrying about whether or not we need to shut down a respite service and whether or not to send people home and isolate. And there's definitely different levels of stress involved, and I wish I could take that away from you in terms of your day-to-day work, and it is part of the job, but it's very appreciated in terms of the engagement that you've all had. I think it's been a phenomenal example of excellent teamwork throughout the whole organisation, so thank you for that. In terms of, we got a question just to add on. I'm just reading the chat on this just now because the question's related to COVID. So it's regarding PPE equipment and cleanliness, etc. So we provide gloves and hand sanitizer, and we've just received an order of face masks. Now, face masks are still not legislatively endorsed or recommended by Queensland Health yet, but we completely respect if people want to use them, and certainly they're being used in areas like Victoria where there is increased infection. So I think we've ordered 10 face masks per employee, and they've all are in the process of getting distributed to each site. If there's any other PPE that you think you require, please let us know. That's the recommended PPE to give out. But if employees think they need anything else, that's fine. We don't normally provide things like aprons. They're not effective in the control of COVID-19. They could be an extra protection for your clothes in terms of work, but that's not something we would normally provide. But if you feel it's required in your work, especially in the short-term accommodation or supported independent living environment, we'd be happy to provide that. I'm just reading the rest of the question. So what are next level infection control measures and cleaning protocols? So the cleaning protocols for short-term accommodation is the same as you would be doing anyway, which is the normal clean down of surfaces, doing a proper client intake when people are coming in around their risk of exposure to infection. We do have COVID cleaning in head office. Laura and Katrina, do you feel we need that in the short-term accommodation as well, like actually having external cleaners come in?
Well, I think we do have pretty good cleaning practices in the houses already. I think if it was to change that, we did have known infection in one of the short-term accommodations, would probably take that a step further to have a full sanitisation of the property.
Cool.
Yeah.
Okay.
I think as long as we've still got hand sanitizer available in all the living areas, and encourage the guests that are staying there to use them regularly, and just have the usual things like lots of spray air disinfectant like Glen 20 and things like that available, then I agree with Laura. The cleaning regime that's already there is pretty thorough.
Yeah, okay. No, thanks for that both. If we have employees who disagree with that, and I'm fully supportive of you both, Katrina and Laura, in terms of your view on that, but if there are employees that disagree or feel that they need something different, please let us know, and we're not going to be defensive about it. If you think we can do something better, we'll implement it. But I think in terms of PPE, that's probably the main areas that we can provide, and just to reiterate, if you feel like you need to purchase your own, we will reimburse that for you. If whoever asked that, I'm just checking I've answered that properly. In terms of training for infection control, you were all sent out the online training for COVID-19 at the start of the pandemic. I think, Jen, if you're okay with that, we'll resend out that training. There was online training that was sent out, I think, at the end of March, and for our first Q&A. We'll resend that out because we've got new staff as well. And I'd maybe encourage everybody to just refresh that training. That gives you all of the information about infection control, and specifically with regard to COVID-19. In terms of other training, I'll touch base on that a little bit later on when we talk about our workforce planning. So I'm just going to scroll through and see if there's anything else on COVID-19 quickly, and then if not, we'll move on to the other areas that we were going to talk about.
Can I just touch on something that's popped up in our live chat?
Sure.
From Pam. So I've been working with one of our members from our marketing team, and we do acknowledge that our screening form does need to be updated. So we will be updating that and circulating that as soon as possible, because I think it has become a little bit obsolete, and there's more criteria now for screening.
Sure. Okay, all right, thank you for that. And another question, Pam, do you feel that question was answered? There's a question around COVID check for family members. Yeah, I think if the form's updated, that should cover it, Pam, I think, the question that you've asked. But if there's any worries about, yes, Pam, thank you. So Pam's confirmed that we've answered the question. But if there's anything around you feel like it's not a safe environment, or you do feel like family members get symptoms, you do have the right to refuse service to protect yourself and everybody else. But I would do that in conjunction with your line manager. So if you're concerned about a client having an unwell family member, touch base with your line manager straight away. And if you can't get them, you'll get somebody in the office, or you'll even get myself if you call head office, and we'll talk you through the best advice before you cancel services. But we absolutely do not want you to go into a situation where you're at risk, and that includes getting the flu. Like, it's not just COVID-19. You've got the right to a work environment free from any kind of hazards or infections. So we will support you if you feel not able to do that, and we want you to be proactive about telling us if you're uncomfortable. Okay, so I think unless there's anything else, we'll move on from the COVID-19, but that's just to reiterate, keep doing what you were doing. Although we feel that Queensland's safe, we want you to still remain diligent in your practice, because I think that's what's had us have an incredibly successful and supportive period through the pandemic so far. So please keep doing what you're doing, and stay alert and vigilant to any issues, and keep washing your hands. I know we don't need to tell you that as adults, but just a reminder that is where we're at in the world at the moment. So I'll move on to staffing updates. So the organisations, it's not grown as fast as it was a year ago, and that's intentional. We're trying to consolidate what we're doing and work out best practice rather than just maintain business growth. And I think we're in a period now where we're gently slowing down, but we're doing so well that we're still needing to take on staff on a regular basis. So when I started at Arafmi a year ago, I think we had around 100 employees, and now we're close to 150. And we see that there's still incremental, gentle growth on a month-by-month basis. And I think that that's largely due to the really good quality work you're doing. We've got an excellent reputation within the industry. We're receiving referrals often for, in particular, short-term accommodation. We're doing really, really well in that space. So with any change in growth in an organisation, sometimes there has to be organisational structure considerations and changes in that space. We've made a commitment to try and keep the organisational structure as close as it is to what it looks like now until December, while we work through our strategic planning. But we did make 2 positions redundant last month, and I sent an email out to all staff to let them know about that. One of them in particular was really around the growth of the organisation and the need for a different type of IT support. And I'll talk you through a little bit about what we're doing in that IT area. But I just wanted to touch base with you all to reassure you that we're not going to make big significant changes. We don't anticipate that there's going to be any more redundancies. There will be organisational tweaks from time to time, but that doesn't mean anybody's job's at risk. It just means we look at the positions and whether they're fit for purpose. We think we've got the right people, but there's definitely some positions that we'd like to support a little bit better. And I'm looking at the service facilitators in particular, and we've talked to them about that, about going, how do we better support you to manage the mammoth job that you've got. So what we're looking at now in terms of organisational structures about support to employees, not about shifting things to any great length. And things like the implementation of the client engagement officer, so moving Jen into that position, I think it's been really positive about having some focused intake. But when we mention the word redundancy, it's very natural for people to be scared or worried about their own stuff, but we're not having wide-scale industry redundancies. We've just had to tweak things a little bit to fit our needs. And sometimes that's really difficult decisions to make. It's definitely one of the areas as CEO that maybe keeps me up at night, or I certainly lose sleep over worrying about where people are at. But I think we're in a position now where we're looking at support going forward. The IT situation in particular, we're now at a position where we have 150 staff. We need to centralise all of our IT. We know we're not quite there yet with it. We've got a few things that we need to do to update security. So we made the decision to engage an IT organisation to provide that, because they can give us an overall holistic support for our organisation, including the proper implementation of SharePoint, making sure that our apps like Brevity are syncing with MyOb. There's a whole bunch of stuff in that area that one individual could never have done. And the reason we had to postpone our Q&A from 2 weeks ago is we thought we'd had a cyber attack, and we were in the process of, we were about to shut all of your emails down to protect the system. So it turned out, and we were very, very lucky, it wasn't actually us that had the cyber attack, but we had to respond. Like this was literally about 2 hours before the Q&A. And Jen and myself were scrambling to go, what do we do? So we were like, we need to shut everything down and just keep it safe. And I think that kind of thing's pretty scary for an organisation. There's a lot of consequences to having a lack of cyber security, but we're in the position now of where we've engaged an organisation to tidy up everything that we need to do. So, and I think from that point of view, we were really grateful that we had an organisation to support us with that, because we had the IT, we had a whole bunch of people working on the situation, and we were working out whether or not it was a cyber attack, whether somebody had lost something. There's a whole bunch of things that we weren't sure of, and we had a whole organisation behind us to be able to help us respond quickly. So that was the reason we cancelled the Q&A, and one of the reasons that we've implemented the new base as our IT provider to give us a better overall service. So I'll pause for breath there around that. Does anybody have any questions on structure or jobs, or any worries that they have around what I've spoken about so far? Silence is good. Okay, I'll take that as a no, but I will reiterate, like with anything, and I have had staff email me previously after the Q&As, if you feel there's something you don't want to bring up in a Q&A session, or you don't want to name on the chat, I'm really happy to get direct emails from it. One of the best emails I got following Q&A was David Austin sending me pictures of the bingo afterwards. So those absolutely brightened my day. If anybody's got to see them, they're pretty phenomenal pictures. So that happened after the first Q&A, and I'm really grateful for the connection with support workers when they do things like that. So please don't feel that you can't touch base with me if you want to. So I'll move on then, and this is the last area that I want to talk about, and then we'll cover some of the questions that you've raised, is strategic planning. So I know that for the past 5 years, the board have had a strategic plan in place that was all about sustainable business under NDIS. So there was a heavy push to transition all of our funding from block funding to NDIS services, and that was a really challenging process. So the main strategic focus of Arafmi, in particular in the last 3 years, was NDIS transition and making sure that clients have the support that they need under that model. Myself and a few key people have met with the board around our strategic plans for the next 3 to 5 years, and we're in the process of finalising the outcomes of that at the moment. But there were 4 key areas, and I'm going to get a bit of paper to remind me of what they were. So the first area that the board have talked about is making sure that Arafmi have a sustainable organisation, and this is probably the most operational and boring part, but the exciting part for me is that a sustainable organisation talks about things like employee security and contracts. It talks about what training and development we need to be a healthy, functioning workplace that's sustainable. So one of the key things that I'm doing while we're still finalising the strategic plan is looking at our workforce development plan. And the workforce development plan is basically where we are now, how many employees we have, what your level of training, expertise and skill are, what types of roles you do, and what we need to keep you happy, healthy and well in a sustainable organisation, and where we want to go to. So we will look at things like, we know that the service coordinators or the service facilitators need much more support. We know that we've got a really fantastic admin team, but they need all the processes in place to make sure that's functional. So what we'll do is a bit of a plan around where we're at now and where we want to get to, and there will be a very, very heavy focus on training and development. We're writing a position paper at the moment for the board around online training for things like your orientation, induction, workplace health and safety, all of the areas that you can probably learn and redo on an annual basis, where you can just get a refresher, and what face-to-face training you need, which will focus on things like risk management, mental health awareness, suicide prevention, engaging in some of the terms around challenging behaviour, dependent on what you would call that space, working with people with more complex issues, professional boundaries, diversity training, all of the areas that you would come in with some kind of skill in, but we want to develop and reaffirm. And there will be a heavy push on good quality service provision and how you engage in that. And that will be focused predominantly on support workers and making sure that you feel absolutely comfortable and around all of the areas of work that we're asking you to do. So that's going to be a plan. And we'll propose that to the board, and we'll work together to see how we can implement that. But it is still likely to take a few months before we really get any traction in that, and that's just about myself and the board making sure wherever we put our budget, we do everything in our strategic direction. But I did want to flag that, because I think it's really important, you know, that you are cared for, and that we value you, and we want to provide an environment where you get professional development, and we know it's not good enough at the moment. And I said that at the staff conference in January. We know we're not there, but I don't want to do it badly. So I don't want to just implement something and it be a bit rubbish. I want to make sure that we get the right support for you and the right training and development. So that's going to take a little bit of time. So if you're okay to be patient with us about that, but if you do have any immediate training needs, please still flag them with your line manager, because those might be something outside the scope of a learning and development plan that we do on an ongoing basis. So that's around the sustainable organisation. I'll pause for breath there and see if anybody's got any questions about the training aspect. And I might just add, Tina, thank you for this question. Tina would like to know how I'm doing in my job as you're new to the company. What we talked about in our staff conference in January, it feels like it was about 12 months ago now, we talked about performance reviews, and we will look at how we do that in a meaningful way. I'm not a fan of performance reviews for the sake of paperwork. I don't want there to be a system that's laborious and we tick boxes and we fill out a form and then we put it in a file. I don't think that's helpful to you. I don't think it's meaningful to the organisation. We want to work and look at a performance framework that actually means something to employees and isn't used as a stick to beat you with. So we are exploring the options of things like community practice sessions. So that's group supports that you talk to each other and you problem solve together and you learn from each other. And we will look at some kind of supervision / professional development support plans for everybody, but we don't know what that looks like at the moment. But what I'd say is we still have the forms that you can give to your line manager around getting feedback on what you need. And Laura and Katrina, you might need to help me here with what they're called.
Self-reflection forms.
Self-reflection forms, yep. So Katrina, can you talk on that just for a few minutes?
Actually, I think they're staff reflection forms, actually, now that I think of it. I think that's right, isn't it, Laura? Yeah. So they're actually just a bit of a platform for staff to be able to identify things that they do like about their position, the things they're finding challenging about their position, any requests for any assistance that they feel that they might need to be able to do their job role better. And it also gives you an opportunity to ask for perhaps some interview time with your line manager. Yeah.
Oh, thanks, Katrina. And I do take on board that that's not enough. It absolutely is not enough. We need to be providing more, but I want to do it properly. So we want to take the time to actually work out what you need and implement it properly. And I think that's the best and fairest way we can do it for everybody. So it's not enough, but I think it's at least a step in the right direction of giving you engagement with your manager around what you need. So I think that was it in terms of the training. So I might move on to the other strategic goals just to give you a brief overview, and I'll be a few minutes, and then we'll go to the questions. The key priority. So we've got 3 key goals that the board are focusing on, and one is absolutely the history of the organisation and the desire to remain true to that, which is about mental health carers. So there will be a very heavy strategic focus on carer supports, and we will look at different innovative models of how we provide carer supports. That's predominantly separate to NDIS, but I want to remind people that when people engage in NDIS services, when that person has a loved one, we are positively impacting the carer space as well. So any NDIS service delivery that we're going to do moving forward will have a look at a carer focus too. So we want to make sure that carers are involved and engaged and can contribute to the organisation just as much as participants. And we have our wonderful carer support team that are going to be providing ongoing services. I think I can see Ruth and Julie's here somewhere. So a few of the carer support team are online at the moment, and we've got plans to work together more closely around the carer support team and the NDIS team working together and knowing what each other's doing, so that we're much more complementary in that space. I think we were a bit siloed before, which is normal when you're doing business development, but now we're in a space where we're flourishing. We'll merge more together in terms of how we communicate with each other. And Jen Spence-Whaley, who's our client engagement officer, she's been connecting with the carer team and looking at cross referrals to, when people come into us looking for services, reminding them that we've got our carer support team as well. So that's a wonderful connection to making sure we're across everything we do. So there will be a heavy focus on carers as one of our goals. Another goal is our carers hub. So you know that we've got a building in Harcourt Street in New Farm, and we are in the process of developing that at the moment. So that will be a focus on some of the strategic areas that myself and the managers will be working on. And we aim to have that building ready in about 18 months. And that will be looking at respite options for carers. And yeah, I can see Ruth nodding your head. Yep, because we don't have that. We haven't had that for a while. So being able to support carers to have their own respite and looking at different ways of doing that, so that we just don't have traditional models of support, and hosting a lot of our events at that hub. So that's one of our other goals. And our other key goal that will all be propped up by sustainable organisation is a strengthened voice in the mental health sector. And that's about our system advocacy and policy advocacy. And that's predominantly the work of myself and members of the carers team. So when things like the Productivity Commission reports come out, that we help influence that, and we support carers to give feedback. So again, that's a very heavily invested carer focus, but that's really at the crux of what we do as an organisation. And for most of you who are in the room at the moment, you're probably more focused on NDIS services, and that sits within goal number 1, which is about quality services that assist carers, and NDIS is a heavy part of that. So that's the areas that we're looking at. So flexible services that support carers, our carer mental health hub, and our strengthened voice in the system. Now that's not the exact wording, that's just a key overall view of what we're doing, but all of that's propped up with a sustainable organisation, which is where you'll see some of the changes in the next few years in terms of investment and engagement in staff, investment of proper recruitment. Not that we're not doing it well, but I think we could definitely look at it a little bit differently. I'm sure Katrina and Laura in particular would agree. We're trying to get more staff in place and quickly, and we're not quite there yet. So those are all the areas that you'll see a bit of a change to. So I'll pause for a breath there and see if anybody's got any question around that particular area. Nope. Tina, I've got a part from you that if we didn't answer your question properly, and I'm completely happy to have a look at that, are you able to type out a little bit more detail about what you would want in the content of the question? And what I'll do is I'll go to the Q&A, and then I'll come back to you, Tina, if you feel like you need more information. So let's have a look at the questions and answers, and I'm fairly sure there's some are going to be a little bit. We're probably not going to give you a completely defined answer, but I think we will try our best. So we have a question around client service delivery, and I'll cheekily pass this one on to Laura and Katrina because I don't want to answer it. What do we do if we have a client who buys alcohol for a family member? Can you talk on that a little bit, just around the general do's and don'ts around, I think maybe that, but also what do we do if we're stuck in a situation where we're not quite sure if it's part of our service delivery? Are you both happy to answer that one? Cool, all right, I'll mute.
Thanks, Laura. Okay, so look, we have to keep in mind that our clients are adults and that they have choice and control over what they would like to do. But the do's and don'ts around buying alcohol is that we wouldn't buy alcohol for them. If they choose to buy alcohol for a family member, we can't tell them not to do that. As far as bringing alcohol to an STA environment, our policies actually state that that shouldn't happen. However, if they choose to go to a club or a restaurant or a bar facility where they're having a meal and decide to have a few drinks with their dinner, that's perfectly okay, as long as they don't come back to the facility with behaviours of intoxication or danger of hurting anybody else in the facility through their actions or themselves. As far as you having somebody on a support shift out in the community in a CAS environment, if they ask that you take them to the pub, if it's only for the pure purpose of buying alcohol, I don't know that that's really a supportive shift that we're offering there. However, if they ask you to take them to the local club because they want to go out and do something social and it's part of their goals that they want to engage in community activities as such, and you're going along to support them so that they can do that, then that's okay. But again, you're just watching for appropriate behaviour and making sure that they're not going into excess or at risk themselves or others. Laura, did you want to add anything to that?
I think that you answered that perfectly. I see that Tina said again that, you know, just about bringing up duty of care. I think we also need to respect people's right to make decisions that we don't necessarily agree with. If it's not putting them in extreme risk of harm, people have a right to make poor decisions, just like we do. So I think that's important to remember as well, that we're not their decision makers. We might not agree with their choices, but if we can support them to make informed choices, then we are upholding our duty of care.
Yep. Yeah, I absolutely agree with that, and that is it's a tough one when you're out there in service delivery land and you're having to make those decisions on your own without that immediate advice. But I think absolutely right, it's dignity of risk versus duty of care, and I think if we were all honest with ourselves, we've probably done stuff that maybe we regret in the morning, or we haven't always made the best choices in life, and I think that's important as adults we do that, and that we're supported to do it. But I think with this one, if you're struggling, I think that's definitely worth a chat with your manager, because there will always be situations where you've got a bit of a conflict of value base, or you're actually not sure it's in the person's best interest, or you feel you're being pushed into doing something that's not part of support planning. And I think that's the part where you need to ask for help, just so that you've got somebody else to give you some guidance and advice, and know that you're not alone in that decision making process. But yeah, it's a tough one, and I'm really glad you brought it up, Tina. But I think if there's particular individuals that we need to shift their support planning with, we will absolutely do that in conjunction with them around what's okay and what's not okay. What I would say is that in NDIS services, we're not a service that just takes people to places to do things. We want to have meaningful supports with people, and our engagement in people's support plan. If people need support to attend the shops, that's great, but that's not our primary function. Our primary function is to support people to have a good quality life of their choosing and work towards their goals. And some things will sit in that, and some won't. If it's about a family member asking you to go shopping and you feel that that's not within the client's goals, then absolutely that's not what we should be doing. But again, we should be having a discussion around what's appropriate and what's not, and we can go back to line manager and just have a robust discussion about whether or not what you've been asked to do is part of the personal support plan. Melina's added a bit of a question to that. So if you know the person has a significant drink problem, could this request be declined under duty of care? I think that's I don't think I can answer that question broadly. I think that's a very specific, individualised choice, because it's technically not our duty of care, but I think there's always situations where we need to look at and go, what's in the best interests of everybody involved, and whether or not we want to participate in something that contributes to risky behaviour. So I can't give you a blanket answer to that one, but I think these are definitely curly questions that you should talk about as a team, and should talk about with your coordinator and line manager, and really have a robust discussion about what's right and what's not. we'll start doing more rounds of the professional boundaries training as well, because I think since we delivered it, I think we delivered the majority of the professional boundaries training late last year. But I'm aware there's probably about 50 to 60 staff who haven't had that training yet. So I think that's something that we'll re-implement, because I think some of the boundaries training will help you work through that and help you work through your decision making process. So thank you for that, Melina and Tina. I agree, it is a complex issue, and I think the most important thing in the learning from today is that we talk about it and we work through it with the team to get the right outcome, and we include the client in those conversations too, because it could be a conversation around, hey, we're not sure this is part of our role, what do you think, and help them work through it. So thank you for raising that question. We've got another, I think we've got about 3 or 4 questions, if you bear with me while I look through them. We've been asked about providing funding towards things like weekly or fortnightly morning teas or like lunches in the park for participants, and can community access employees create small groups for regular social meetings. So I can give you the philosophical answer to that, and I can give you my Scottish answer around being tight with cash and how that works. So I think if people want to engage with each other on a social level, participants want to connect with each other, we should absolutely 100% support that. But what I would like to see happen is that we work with them as individuals to create that community or those social events themselves. So we absolutely provide the support to it, but it's directed by them rather than us providing a group environment that people come to. I'm happy to be challenged on that, Laura and Katrina, if you think or any of the other service delivery people, if you think I'm wrong, I'm happy to shut up about that. But my view is that we let the clients direct how they want to engage their services, and then we provide the support to do it. I'll pause for a breath there. Laura, Katrina, any opposing views? Does anybody else have an opposing view to that around like the clients directing it and us supporting rather than us directing? I'm happy to hear about that if you think differently. Cool. Okay, if you do think differently about that, please raise it with us, because I think that's a good philosophical question around what's the nature of our role in NDIS and what we create and what we facilitate. And I think probably support and facilitation is the way we should be going, but we can look at that. In terms of the funding, I think at key events, there's absolutely no reason why Arafmi shouldn't provide some things, but when we talk about recovery and capacity building services, if people want to do things and want to have social events, I think it's a very reasonable thing for people to contribute to those, because that's part of reasonable contribution to life events. And when we look at funding for NDIS, it talks about reasonable and necessary. And I'm not necessarily sure us providing funding for picnics or morning teas sits within the model of people self-directing. But if there's particular events like public holidays, Christmas, significant get-togethers, there's absolutely no reason why we can't do that. But my challenge to when we do group events is how do we help people pay for things that they want to have in life? Does anybody have any comments about that? Or go, Irene, you're being a tight ass around money and stop being so Scottish around those things. Any comments?
We have our client activities coordinators for each house too, which will be starting to help coordinate a group of people to do activities together once the restrictions start to ease a bit more. But then we also, if they want to be social, we have our online bingo, which is fun, so that people can get together and join in the fun. There's also the yoga. So there are things going to start brewing. But yeah, in terms of us sort of sponsoring lunches and get-togethers, it will be more activity-based, so people can socialise.
Thanks, Jen. And I think during COVID, we put on a lot of things at no cost, because such an unusual circumstance, we wanted as many people to be able to access and contribute as possible without any barriers. But I think now that we're steadily getting into some kind of semblance of normality, that's a place where we start helping people look at their goals again. So the wonderful work that Jen and Leanne and the team did around getting all of those client activities together really was about trying to ensure people weren't isolated during a really fundamentally tough time. So, but now we're back on track. We should be looking at going back towards goals. Let me have a look at any other questions that we've got. Just bear with me. There was a question around access to support plans. Now, I know we've been saying this for a while, but we are still in the process of implementing Brevity, where you will have access to risk management plans, etc., all of those things, to help you provide the best quality support for clients. What I'm going to say is that under no circumstances at all should any employee be going out to see somebody that they don't know without getting the appropriate information to make them be safe and informed in their role. And if that isn't happening, I'll talk to the team around how we can shift that straight away. So I realise there's times that we put people on shifts quickly to fill shifts where we might not always give people adequate information, but that needs to change immediately. So we've got a senior management team meeting on Monday, and I'll raise that with the team around, not in a negative way, like how best we resolve that from happening. So if there is anything we need to shift, you'll see a pretty quick shift with that. While we're still working on Brevity being implemented across the organisation. And when Brevity is implemented, you'll have everything on your phone. So you'll be able to see it in advance. You'll be given time to read it before you go out to provide services. Tina's just said, "You're awesome, mate." Was that to me? Thanks, Tina. I'm going to take that as me, but that's a nice comment for whoever that was. For. I think that's all of the questions that have come up. So I'm just going to, is there another, Tina says, no, it wasn't for me, thanks. I love your honesty, Tina. Does anybody else have any, so we've got a question, how long are we going to be until we're going to be using Brevity? Fiona, that's a $1 million question, where the issues that we're having is that it's not syncing properly with our payroll system, and the finance team have been working behind the scenes to try and work with the organisation who's providing it to get it right, and we're not quite there yet. So it's being implemented in Mount Gravatt and it's working well. However, there's still issues with syncing on MyOb, which is our payroll system, and that's the challenge that we've got. So there's double the work in some areas, so we don't want to implement it fully because we do pay per user until we've got it right, because we're still kind of doubling up to do the payroll part. So we're hoping by the end of the year, and I think that's a reasonable and conservative timescale around it, and I completely understand that there's frustrations around that, but again, if we start paying per user and it's not right and we're doubling up with work, we don't want to do that. It's just going to be money away from Arafmi that we could use on things like staff training and development or lunches for clients. Pam's asked a curly question, when are we going to see our work phones? So Pam, we had at the staff conference, we were like, yep, this is what we need to do. And we did a bit of a budget around being able to provide everybody with phones, and the cost around it was not sustainable. The reason it's not sustainable is we're in a contract with an organisation around our soft phones at the moment, so that's TAA, and we cannot get out of that contract, and it would cost hundreds of thousands of dollars to do that. So that's just not an option for us to do that. So the decision will be made to move on with our soft phones, which will require employees to bring their own handsets to work. I think it's not a choice I would like to make. It's not a choice I'm happy with, but I'm kind of stuck with it in terms of the financial engagement. Amy, we've got 2 more years on that contract, so it's locked in. So we just did some staff training on how we use the soft phones this week on Wednesday. We had that, and we'll roll that out to everybody across sites on making sure that you've got soft phone access. It will only need to be used for people who are doing community access, support facilitators, support coordinators and managers. Generally people who are working at the houses and are only working in short-term accommodation won't need to use their mobile phones at all for work. We've got an ICT implementation that's happening just now with security, and there'll be a bunch of things that will happen over the next couple of months that will tie into that, including who needs a phone, who needs a soft phone, who doesn't need one, all of those kind of things. But at the moment we can't provide handsets to absolutely everybody. It's just prohibitive financially, but there will be key people where we will be able to give them to on an as required basis. I'm sorry that's not the answer that you want to hear, and it's certainly not the answer I wanted to give. I was very committed to let's shift this and provide equipment to employees, but it's hundreds of thousands of dollars that we wouldn't be able to manage to sustain. And unfortunately these are some of the difficult decisions that we have to make sometimes, and I appreciate that it might not be popular, and I'm happy to take the flack for it, but it's we sometimes have to make difficult financial decisions, and that's one that's been made. Fiona, you haven't got the code for the soft phone. Touch base with your line manager around that, and we'll sort that out. We know that there has been some challenges with implementing the soft phone system, and I think that's largely been that we haven't implemented training properly, but we're in the process of doing that now to make sure we can get best usage of them, and we will look at better options when we'll look at options when our contracts up with the company that we've got at the moment. Any other questions that anybody's got, or any comments that anybody wants to make? Not seeing anything come up. Laura and Katrina, if you get any final comments that you want to make for people before we end for the night?
Nothing really in particular, excepting that I think moving forward with Brevity coming on board, I think it's really going to make everybody's jobs so much easier and more accountable. So when it comes, it will be good.
When it comes, we'll get there. I've been always told not to apologise for delays, but to thank people for their patience. So well,
Gary's laughing at us at the moment.
Yeah, and it has been implemented really well in Mount Gravatt, and yeah, it's been fantastic. And our delays, we don't want to pay the per user per month while it's not functioning properly across the organisation, because it's a lot of money. So, and that's about making sure that we use our resources as best possible, and acknowledge that that's incredibly frustrating for the staff while we do that. But again, we want to focus our funding and our commitment to use a team and your professional development and support. And I think that's sometimes we just have to have a balance there. Laura, did you want to add anything? And I will go to Jen after this.
No, it was just nice to see everyone get together. Sadly, not as many as we have previously, but I guess we'll make the recording available to those who weren't able to attend, because I do know that there was many people who were unable to attend today.
Yeah, cool. Thanks, Laura. And yeah, and just on that, we mucked about with times because, well, one, we didn't want to impact on the bingo on Thursday because it's been such a huge success. And I know I haven't seen David here, but like the bingo has gone down so phenomenally well. We didn't want to impact that, and we were just trying to fit it in at a time that might work. But I think we'll move back to later meetings for the next one, and we might take a bit of a poll on what day works better for people. I'm assuming Saturday mornings at 8 AM are not the preferred option of time. You'd be happy with that, Ruth? Yeah, okay, fair enough. You can lead the meeting, Ruth. Jen, just on behalf of yourself and Leanne, who continue to work furiously in the background to make everything happen and get it all out there, is there anything you want to add or highlight before we say goodnight?
No, so with this video, we'll put it up online, and just quickly, and we'll sort of maybe touch on some of the points that we discussed and some of the forms that you mentioned. So keep an eye out in your emails.
Cool. No, thank you for that. And Tina's just asked where my dog is. So Stewie's at home. I'll make sure he's in the next meeting. But I think some of you might have seen Laura's got a new puppy as well, Gus, who's been making a few visits to the office. So Laura, maybe next time you can bring Gus along as well, and we'll have a bit of an animal afternoon at the end of the meeting like we did last time.
I'll have to protect my my charger because he has destroyed it.
Yeah, fair enough.
For my laptop.
And Jen's going to bring Snow. Perfect. Cool. So yeah, we can do that. Yeah, we'll make sure we're at home next time with the animals. And you can bring yours too, Tina. That's perfect. Okay. So thank you, everybody. Sorry it's not been as many people, and sorry if it's just been a little bit narrative tonight. I think it is important that we all connect with each other, and even for those of you who are watching on YouTube and have managed to get to the end of this, thank you for your patience and your time. It's a small way of trying to stay connected with you during a strange time, but also it's a challenge for an organisation this size to stay connected. So I think we will keep these going, even if 5 people can attend, it's more than none. So I think it's a good way of just trying to stay connected with people who aren't based in head office. But thank you for your questions. Thank you for your challenging questions. Thank you for all the contribution that you make into Arafmi. We're doing a phenomenally good job, and we're well recognised in the community. And that's not just because of my pretty face. It's because of all the work that you're doing, and the work that you're. Why are people laughing? It's because of the work you're doing with clients and carers, and you are doing a fantastic job. And I know that we're still in the cusp of the pandemic and things are still challenging, and I do thank you for the way that you're managing this. It's very, very appreciated. So I'll say goodnight to everybody now. If everybody wants to just put on their cameras again so I can see your lovely faces before we go. Gary, don't worry about yours. Thanks, everybody. It's really lovely to see you, and I appreciate you taking the time to dial in and ask questions and make comments. And we'll try and set one up for another 6 weeks' time. I think that's a nice time to give us some space, and we'll have the strategic plan finalised hopefully by then. And I'll go through a little bit more about what we're doing operationally, just so you know what we're doing on a day-to-day basis, and have an idea of what our plans are for the future. So I'll love you and leave you. Thank you very much. Really appreciate all your time, and take care tonight and tomorrow, and then have a lovely weekend for those of you who aren't working. Okay, good night, everybody.